Welcome. Today, we're diving deep into a heart condition that might not be widely known, but can have significant implications: noncompaction cardiomyopathy, often abbreviated as NCCM. Understanding this condition is crucial for early detection and better management. Join us as we explore the causes, symptoms, diagnosis, and treatment options available. So, what causes noncompaction cardiomyopathy? The exact cause is still being investigated, but it's believed to be primarily genetic, often running in families. Mutations in genes responsible for heart muscle development during embryonic life are implicated. These genetic mutations disrupt the normal compaction process of the heart muscle. Sometimes NCCM can also be associated with other conditions such as neuromuscular disorders, metabolic diseases, or even occur sporadically without a clear genetic link. Further research is underway to fully understand all the potential causes. Now let's discuss the pathophysiology, or how the disease affects the heart. During normal heart development, the heart muscle, or myocardium, undergoes a process called compaction, where it becomes solid and smooth. In NCCM, this compaction process is disrupted, leading to the formation of prominent trabeculations. These are deep recesses or spongy structures within the left ventricle. These trabeculations create a distinct two-layered appearance of the heart muscle, a compacted outer layer and a non-compacted inner layer. This abnormal structure weakens the heart muscle's ability to pump blood effectively, leading to heart failure, arrhythmias, and other complications. Epidemiology refers to the study of how often diseases occur in different groups of people and why. NCCM is considered a relatively rare cardiomyopathy, but its true prevalence is difficult to determine due to varying diagnostic criteria and the fact that many individuals might be asymptomatic. It affects both children and adults and has been identified in individuals of all races and ethnicities. Estimates suggest it may affect between 0.1% and 0.26% of the population. What are the signs and symptoms of NCCM? Unfortunately, many individuals with NCCM are asymptomatic, meaning they don't experience any noticeable symptoms. However, when symptoms do appear, they can be quite varied. Common symptoms include shortness of breath, especially during exertion, fatigue, chest pain, palpitations, or feeling like your heart is racing or skipping beats, swelling in the ankles, feet, legs, or abdomen, and dizziness or fainting. In severe cases, NCCM can lead to heart failure and sudden cardiac arrest. The severity of symptoms can range from mild to life-threatening. Diagnosing NCCM can be challenging as its features can sometimes overlap with other heart conditions. The primary diagnostic tool is echocardiography, which uses ultrasound to visualize the heart's structure and function. Cardiac MRI is another valuable tool, providing more detailed images of the heart muscle and helping to differentiate between compacted and non-compacted layers. Other tests that may be used include electrocardiograms, ECGs to detect arrhythmias, and genetic testing to identify any underlying genetic mutations. The diagnosis is often based on specific criteria related to the thickness of the non-compacted layer compared to the compacted layer, along with other clinical and imaging findings. While NCCM isn't strictly classified into distinct types in the same way as some other conditions, it can be categorized based on the presence or absence of other associated conditions, like neuromuscular disorders. The presentation can also vary significantly, from being an isolated finding to part of a more complex syndrome. This variation in presentation highlights the importance of personalized management. The treatment and management of NCCM focuses on managing symptoms, preventing complications, and improving quality of life. There is no cure for NCCM. Medical management often includes medications such as ACE inhibitors, beta blockers, and diuretics to control heart failure symptoms. Anticoagulants may be prescribed to prevent blood clots, especially in individuals with atrial fibrillation or a history of thromboembolic events. In some cases, implantable cardioverter, defibrillators (ICDs) may be recommended to prevent sudden cardiac arrest. For individuals with severe heart failure, heart transplantation may be considered as a last resort. Lifestyle modifications, such as a low-sodium diet, regular exercise within safe limits, and avoiding smoking and excessive alcohol consumption, are also important. Unfortunately, there are no specific preventative measures for NCCM, particularly when it's caused by genetic mutations. However, early diagnosis and management are crucial for preventing complications and improving outcomes. If you have a family history of NCCM or other heart conditions, genetic counseling and screening may be recommended. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can also support overall heart health. The prognosis of NCCM can vary significantly depending on the severity of the condition, the presence of complications, and the individual's response to treatment. Some individuals with NCCM may live relatively normal lives with appropriate management, while others may experience progressive heart failure, arrhythmias, and an increased risk of sudden cardiac death. Research continues to advance our understanding of NCCM. Recent studies are focused on identifying novel genetic mutations, improving diagnostic imaging techniques, and developing targeted therapies to address the underlying mechanisms of the disease. Gene therapy and other innovative approaches are being explored as potential future treatments for NCCM. With ongoing research, we hope to improve the lives of those affected by this complex heart condition.